Hello InstaFam, it's Dr. T here. I am at day 21 post first chemo. I'm day 1 post my second cycle of chemotherapy. Had a massive 9 hours in the IV suite yesterday, but had a much better experience than the first time. Kind of knew what I was coming into. Also advocated for myself on a few things and had just an exceptional nurse looking after me. VJ, giving him a massive shout out. What an exceptional human being he is. Also a massive shout out to Kate Austin, who is the clinical nurse in my oncologist rooms. She has been fantastic and very reassuring to me. A great human being. So how are you guys? You good? You good? We are going to do rapid fire Q&A. So if you have any questions, I didn't actually get any DMs apart from beautiful messages of love and hope. So thank you for all of those. But if you have any questions that you would like to have addressed, please don't pop them into the comment section down below. You know my rules and guidelines, make it generic. I'm not going to answer your whole medical history on here, and make it clean. And we'll see if we can get some answers out to you. So yeah, what else? Does a mammogram, oh, what a good one. Does a mammogram go up into your armpit? No, it doesn't actually. The mammogram looks at the breast tissue in 2 directions. So they take a superior and inferior shot. And yes, they do squeeze your boob between 2 plastic plates. And then they take a sideways midline and lateral shot. And again, your boob gets squeezed into a little plate. And there are special grading systems now to look at the density of the breast on the mammogram. And with dense breasts, they then recommend that you have ultrasound. Now, the ultrasound is quite detailed. They look at all areas of the breast in a circumferential outside to medial look, but they also look up under your armpit or your axilla to look at the lymph nodes. So yes, you do need to physically check. So when you're doing a breast self-examination, I'm not going to show you on me right now, but I would definitely recommend that you all know how to examine your own breast, because in truth, if it wasn't for me kind of knowing my own breasts and knowing how they felt, and in January kind of going, it doesn't quite feel like it used to feel, it probably wouldn't have given me the impetus to go and get the imaging done in as much of a hurry as I did. So there's a couple of different ways, but absolutely you should get this done when you go and see your GP. Now, of course, with pap smears now moving out to 5 years apart for many women, the opportunistic attendance of your GP is not as much. So I would always recommend, if you're a well woman, you should go and get a well woman check by your GP every year. And you should get a breast examination. But you can also do your own because you know your breasts best. So the first thing to do in your bathroom with your top off, just raise your arms up and down and look for any bits that might appear tethered, or what we call peau d'orange, where you get this kind of wrinkling appearance to the skin. Or just any changes to the nipple, itchiness, discharge, anything like that, tenderness, you should definitely go and get seen by your GP. The way I was always taught to examine is, again, hand on head, feeling into the armpit, right up there, feeling for any lumps or bumps, lymph nodes, and the tail of the breast goes up underneath the armpit. And so again, with the flat of your fingers, just feeling. I like to do it in the quadrant method, so upper, outer, inner, upper, lower, inner, and lower, outer, and then right underneath the nipple as well. The other way is the lawnmower method. So again, always doing up under the arm and the tail of the breast, and then just up and down, up and down, up and down, all the way to the midline, and then feeling under the nipple as well. So that's the other way. And of course on the other side. So you can do that in the shower or just when you hop out of the shower. It's a really quick and easy thing to do. And because you know your breasts really well, then you should be doing it. And age doesn't discriminate either. So you should be doing this in your 20s, your 30s, definitely in your 40s, definitely in your 50s, taking control of your own health. So Good question to ask. Thank you for asking that one. Now, there was a question. If you had progesterone left over from previous cycles, can you use leftover ones if you run out before buying more, if they haven't expired? Yes. Yeah, yes, you can use them. Obviously, with the compounded pessaries, they should have been in the fridge. So if they've spent any time out of the fridge, they're not usable. But yes, as long as drugs have not expired, that goes for the pens as well. You can still use them in subsequent cycles. And I would recommend you do that because these medications are not inexpensive. So definitely do that. Yeah, lawnmower. You never forget the lawnmower. So that's really good. Any more questions? Pop them in. While I'm waiting, I'll tell you a little bit about my day yesterday. I'm going to put a bit of a reel together so you can have a look. But I did the cold cap again. It does add an extra 2 hours to my treatment, and for a kind of 60-40 success rate, I'm doing a little bit of this. I have lost some hair. Certainly I can sort of pull the little bits out, and it does feel thinner. And my husband and I have a pact that if he sees any bald spots, then the whole lot's coming off. And don't worry, I won't leave you guys out. In fact, I'd love your opinion. I want you to drop it into the chat. Do you think go bald, go wig, or go sort of head covering? Like if you were to walk into my office with your partner, what would make you feel most comfortable? And what would make your partner feel most comfortable? And I know it should be about me and my choices, but I also think that it's important to make the people around you feel really comfortable. And I know one of the driving forces for me doing the cold cap is actually how I felt my children would feel seeing me with bald head. So I'm also keen to know what you guys think as well. TikTok, so wigs, you saw some great ones on TikTok. Yeah, I've seen some good ones too. They're really expensive. $2,500 for a really good wig. It's a lot of money. Maybe I could just go like a pink wig. Do something really extravagant. Oh, thank you. Look great with whatever I choose. Thank you. All right, here's another question. Do progesterone injections work well if you bleed before day 6 after a transfer? Yeah, there is some evidence that bleeding through your pessaries, so let's say you're on pessaries and you start bleeding before you get your preg test, that's not good. And it could herald one of the reasons why you've had difficulties falling pregnant. So micronized progesterone in oil is still deemed to be the best form of progesterone support, but there are risks that go with it. I mean, most people who do intramuscular progesterone injections know how much they hurt. And if you are pregnant, you're going to need to continue them through past 10 weeks, which is often challenging. But there's also a small risk of infection and abscess development as well. So that's why we choose to go the less burdensome way first. And if it doesn't appear, if problems arise, then I certainly will be quick to suggest the use of intramuscular progesterone. Head covering would rock. Yeah, I'm thinking those beautiful like turbans with some gorgeous colours. Ex-hairdresser, go for wigs and head wraps, lots of fun. Maybe I should just go and do a wig day. You guys can come along and see. Go the wig. My sister went through chemo, helped with a mood. Yeah, I do. I've listened to a lot of stories about it improving your own self-confidence. So yeah, pink hair. I reckon I could carry it off too. Low AMH. If just classed as low, at what stage do you need to investigate further? Okay. So here's the thing about AMH. Remember, it's not a measure of your fertility. It's not a measure of your fertility. You can have a low AMH, and if you're young, the quality of your eggs will be good. And so you can go out and have sex tomorrow night and fall pregnant like that, regardless of how many eggs you've got left. It's all about the quality, and the quality then is commensurate with your age. So there is an expectedly low AMH, and that would be, say, in a woman of 40. I would expect her to have an AMH about the 5th centile, 5, an AMH of 5 picomole per litre. If, however, you're 30 or 32 years of age and you have an AMH of 5, that's not normal. That's not normal. So I would always go and investigate. Is it because you're on the pill? Have you had surgery and lost an ovary? is there any other reason? Because I'm not thinking about the baby that you want right now. I'm thinking about the baby you might want in 7 years when the AMH will just continue to decline. So I do think that if you have been classed as a low AMH, whatever age group you are in, I would recommend that you go and have a chat with someone who knows about the fertility stuff and the discussion around AMH. Thank you. See you, Bottle Blonde. Whatever makes me comfortable, 100%. How much can an AMH level drop in a year or two? Well, it's falling all of the time. You can go and Google AMH graphs. Yeah, go and have a look. There is a beautiful table that was developed by Scott Nelson. So you can put his name into Google too and go AMH graph. And you'll see a beautiful graph of the natural decline of an AMH level. So unless you're undergoing some iatrogenic changes, so you might be going through chemo, like me, or you might have an operation on your ovary, or you might have endometriosis that's destroying the ovarian tissue. Unless there's something else, your trajectory down will follow the trajectory that is on the graphs on Google. So go and have a look. But it can drop by a year or two. Is AMH the count of how many eggs you have left, and does stimulating and extracting eggs mean whatever is left goes? So no, great question. Great question. I've been asked this quite a lot. Your body will recalibrate. So if you have a low AMH, you will, and you're young, let's say you're 30, you will release each month a cohort that is correlated with that low AMH. And as your AMH drops, less and less eggs get released. There's amazing checks and balances that happen in your reproductive system. And there's been nice comparative work comparing a woman on the pill to a woman who has cycles every month to a woman who is pregnant back to back and so therefore doesn't have cycles. Their age of menopause will be similar. And it'll be exactly the same as what they were predetermined to have. So us doing an IVF cycle, all we're doing is recruiting the group of follicles that you would have lost anyway in that cycle. You know, normally in that cycle, you would release one would ovulate, but you'd have a group of others and they would just die. So we're not depleting the store. The AMH and various other checks and balances won't allow us to release them any quicker. So your body's ingenious, really good. All right, whatever makes me comfy. Thanks, Em. If you're on combination pessaries with estrogen, would these also have to remain? Yes. Yep. So generally speaking, we will begin the weaning process of whatever supplements you are on from about that 10-week mark. Why? Because that's the transition, or it's actually just after transition from the corpus luteum to the placenta taking over the majority of that hormone production. And we want to make sure you've got maximum hormone support as that placenta is really burrowing in and creating that survival platform for the baby moving forward. So we know that small placentas equal growth restricted preterm babies, so we don't want that. So you've got maximal placentation in sort of week 13, 14, 15. So by that time, generally speaking, you'll be off all medication by us gradually weaning it down. Hopefully that was helpful. All right. Erin, can you have low progesterone even if your levels test normal? So the serum levels are fairly well correlated at the endometrium, unless of course you've got blood flow issues to the lining, and it's very difficult for us to measure that. Generally, we would see that in someone developing a thin endometrium despite good estrogen levels in the serum. But we do know that women with endometriosis, for example, have very poor progesterone receptors. So sometimes it's not just about what we're measuring in the bloodstream, but how it is being received at the level of the endometrium. And so that's sometimes one of our reasons for kind of going up and over, is that we've got to flood those progesterone receptors with adequate amounts of progesterone to ensure you're getting that adequate endometrial development. Amy, if you're young and live a healthy life, what can you do to improve egg quality if it's believed to be a problem? Not a lot, my love, if you are young. There's lots of stuff out there, sort of DHEA, CoQ10, testosterone, growth hormone, not that I support that, melatonin. There's all these products that are out there on the market that really haven't been rigorously tested. Some of them are expensive, some of them are relatively cheap, and so it's definitely worth a discussion with your doctor. And remember that an embryo is made up of 2 parts. So if someone's telling you have poor embryo quality, it's also important to look at the lifestyle of the man as well. Oh, Emma, you're a darling. Thank you for that. I'm feeling not too bad now, but I'm probably going to crash later on this week. Maddie, if unopposed estrogen is a risk factor for endometrial hypertrophy, carcinoma, etc., how long typically is this exposure, or is it up? You're right, Maddie, it's very unknown. And there are women who, despite us giving them unopposed estrogens, they just don't get good uptake into the endometrium. So they actually require prolonged unopposed estrogen to help them develop a lining. This is in the context of fertility. I'm speaking about those with a thin endometrium. So we're not too worried. Certainly from the menopause point of view, it's age dependent, obviously. So you might not be giving, say, a woman in her 50s unopposed estrogen for greater than 3 months. But the length of time is not very well understood. So because we do know that there are risks with unopposed estrogen to the endometrium, we don't recommend giving it in an unopposed way in older women for very, very much length of time. What supplements should you take before a FET? Well, the only one that is thought to be of any great benefit is folic acid. The rest, if you eat a good Mediterranean diet, you're probably getting adequate amounts. It's worth probably checking your iron levels and your vitamin D levels. If you're having a couple of fish meals a week, you're probably getting your adequate omega-3s. But yeah, the only one that is deemed to be of absolute importance is folic acid. Mrs. Staines, is there anything to do prior to an egg collection to help avoid OHSS? Yes, lots of different things. It's incumbent on your practitioner choosing the right drugs to both stimulate you and trigger you. Being on metformin is deemed, even if you don't have diagnosed PCOS, there is a reduced chance of OHSS. Mainly it comes down to patient selection, dose selection of your drugs, the appropriate trigger to use. If you're beyond that stage, make sure you're staying really well hydrated, because what happens in OHSS is the fluid kind of third spaces out of the vessels into the surrounding organs. In your tummy, you get ascites around your heart, around your lungs, so it can be quite life-threatening. And so part of the way of keeping you well hydrated intravascularly is really important. The other thing is to eat plenty of protein to help keep that fluid inside the vessels, which is hard to do after you've had an egg collection when you're feeling pretty rubbish, but you've really got to do it, and these are our reasons. So yes, but it's actually all about choice, patient choice. Would you treat subclinical hypothyroidism in the preconception period or just in pregnancy? I would treat it when you're trying to conceive, if there are anti-thyroid antibodies present, or if the TSH is above 4, even if the thyroid function, because it shows me that the brain is working quite hard to turn the thyroid on, and I know that's only going to worsen during pregnancy. So it's important in those early weeks that you're starting to get good placentation, because it affects what happens later on in the pregnancy. So that's my opinion, and that's how I practice. Curious question, are you seeing an increase in couple using donor egg processors? 100% I am. 100% increasing couples, but also increasing single women wanting, they're probably more donor sperm. But yes, I'm seeing a lot more, and that's because we're leaving pregnancy later and later now. So it is harder and harder. Let me tell you something. Let me give you an honest truth. IVF was never developed to overcome age-related infertility. That's the truth. We do it because it helps us get to pregnancy quicker, and there's a greater probability that we'll be able to create an embryo that is chromosomally normal if we're doing it with several eggs as opposed to doing it just with one egg. So it's just a probability game. But the reality is, over 40, we're not very good at helping women conceive because IVF isn't that successful. And I would go and educate yourself using the Your IVF Success website. So it's called yourivfsuccess.com.au. Go and plug into the IVF estimator your partner details and your details, and look at what your personal chance of success is if you are in that age group over 40. I think it's very eye-opening. We do it because we have nothing else, but it was never what it was designed for. So we're still not that great. Oh, guys, these have been fantastic questions. Thank you for asking them all. I'm going to leave it there for now. I've got a little reel that I'm going to create for you guys so that you can have it and share it, just about how did Hilary Swank have two babies, a boy and a girl, at the age of 48. I think it will be quite eye-opening, so I'll create that for you in the next few days. I hope you have a beautiful week. I will definitely be back next week. I'm feeling okay today, and I reckon by next Tuesday I'll be feeling pretty good too. And I promise I won't leave you out if I decide to shave my head. I will let you guys know. Oh, you're so late to this, damn. Sorry, Liv Grace, but go and have a look through. It's alive. It'll be recorded. And any questions that you might have, then you can always pop them in a DM to me and I can answer them next time. Have a beautiful week, guys. See you soon.